This is a video on community health workers. In the last video, we highlighted who community health workers are and what they do. In this video, we will examine the international roots of the community health worker workforce and some of the challenges and processes used to professionalize the field. I'm Kiana Jackson, a community health worker with NOVUS Health in St. Louis. I have more than 8 years of experience in various roles from family and child development support to cancer prevention. And as a community health worker, I'm now part of a worldwide community with historical roots that go back hundreds of years. The history of community health workers is long and varied, but many around the world attribute the work of community health workers as beginning when neighbors first aided each other to take care of their health. Over time, those seeking to promote wellness saw the promise of building on these natural helping systems to establish formal approaches. The many programs and community health worker services we see today include both paid community health workers and volunteer aid programs and networks. The informal assisting giving tradition continues to today. Community health workers extend that tradition. One of the most well-known earlier programs is the Chinese Barefoot Doctor Program. These barefoot doctors acted as primary health care providers in their rural communities, but were perceived as peers as well because of their continued involvement in farming. By the 1960s, China had developed and institutionalized community health workers nationwide, prompting a boom of community health worker-led programs in other countries, including the US. Over in Brazil, informal health workers have been providing health education and basic care to poor communities in the Amazon and the northeast of Brazil. In the 1980s, they carried out a Catholic Church based program that taught basic hygiene and nutrition to poor women with children, contributing to a successful decrease in the Brazilian infant mortality rate. The Brazilian government created its official community health workers program in 1991. In 1998, the National Community Health Advisor Study helped identify the core roles, competencies, and qualities of community health workers. With little existing literature on the role of community health workers in the healthcare system, this study helped provide guidance to policymakers and practitioners on a number of areas that could improve the status of the community health worker field. In 2014, the CDC published the Policy Evidence Assessment Report on the policy components of community health workers. The CDC identified 14 community health worker policy components and examined them using the quality and impact of component evidence assessment method. The study found a strong base has emerged in study in support of many policy components that could comprise a community health worker policy. 8 of the policy components fell into the best category, 3 into primacy, and 3 in emerging. The study further strengthened the consideration of community health worker interventions and policy options to improve chronic disease outcomes. In 2022, the U.S. Bureau of Labor Statistics Occupational Employment and Wage Statistics for Community Health Workers geographic profile highlighted CHWs employed in various industries in all 50 states. Industries ranging from grant making and giving services to offices of dentists. With the growth in the community health worker profession, also came changes to the requirement to become one. Although this may have potential policy impact, some have expressed concern as these requirements may devalue the skills and attributes that make community health workers unique. Community health workers in the U.S. have an important role to play in our country that is increasingly being recognized in both healthcare and in community-based settings. Community health workers work in partnership with community members and other health human services providers with the goal of improving health and access to systems of care. To do this, American community health workers often operate in their primary role as cultural mediators as they help make health and social service systems more culturally competent for community members, while also presenting community concerns to health professionals. Often, the communities they represent have traditional healing systems that were developed long before Western medicine developed. Now, the two systems coexist, with individuals and families integrating what they consider the best from both systems to maintain and improve their health. Generally, health professions have become recognized by defining themselves and helping others to understand what they do to improve health. At times, health professionals have faced conflicts and other competing professions and have had to struggle for respect and legitimacy. This has been true for many health professional groups such as nurse practitioners, midwives, home health aides, and community health workers. In 1970, 500 community health workers and their supporters joined together within the American Public Health Association and what was then called the New Professional Special Primary Interest Group. The name New Professionals was chosen in protest against the many terms used to describe them, including non professional, sub professional, aid, auxiliary, and paraprofessional. In the year of their formation, the new professionals wrote, "For too long, non-degree health workers have been left out of the mainstream of planning for the delivery of health services and have gone without recognition and reward. It is our hope that the National New Professional Health Workers will be able to change the status of workers across the country and thereby improve the health of the nation." American Public Health Association, 1970. In 2000, the group changed its name to the Community Health Worker Section and continues to promote the community's voice within the healthcare system until today. For at least the past 6 decades, American community health workers have been actively organizing on local, state, and national levels to ensure that their knowledge, skills, and contributions are valued, respected, and integrated into health and public health systems. For example, Georgia Rogers, our NOVUS Health community health worker in Southeast Missouri, and I participated in this year's annual Community Health Worker Conference as members of the Community Health Worker Association of Missouri. The conference provided community health workers, researchers, educators, and other healthcare stakeholders an opportunity to convene for a shared experience of continuing education, networking, and a platform to discuss ways to collaborate with each other to rally for the sustainability of the community health worker workforce. Strategies that are being used to advance the community health worker field include conducting research about the field to further clarify what community health workers do and how effective they are, founding national and regional community health worker associations and organizations as a way for community health workers to have a collective voice in determining the development of their profession and advocating on behalf of the communities they serve. Developing appropriate ways to credential or certify the work of community health workers. Developing training programs and materials that teach the core competencies required for success as a community health worker. Advocate, advocating for policy changes that will result in more stable funding for community health workers, and developing regulations and procedures to take advantage of the funding opportunities in the ACA. It all starts with you. To learn more about community health workers, you can visit some of the pages mentioned in this presentation. The U.S. Bureau of Labor Statistics, National Academy of State Health Policy, and MHP Salute are all great places to get more info. Or discuss what you've learned from the video with a coworker or a friend to spread the word about the good work that the community health workers do around the country and in the world. Or you can get involved by signing up to volunteer with your local community health workers, or think about other ways you can support the community health workers you may know. Thanks for watching.